Lindsay Brown. I'm one of the nurses. I'm going to be doing my physical assessment today, but prior to doing anything, we want to get and receive consent from the patient, just saying that she agrees to do this physical assessment and just stating that she has the right to refuse and she understands that.
Yes.
And also just stating that anything she does or says will remain in privacy. Alright, so first thing we're going to do, we're going to inspect the face, the skin, and we're just looking to see if it's evenly colored, if there's any open lacerations or lesions, and just seeing if the color is evenly dispersed. So yes, it is. Then we're going to inspect and palpate the scalp and cranium. So first I'm just taking a look. I'm looking at the hair. It's normally distributed. There's no patches of missing hair. Also, I'm just going to palpate the cranium. Any tenderness there anywhere?
No.
Have you ever suffered from a head injury?
No.
Okay. Now I'm going to inspect the face for symmetry and expression. So if I were to ask her to smile, the face and the smile is symmetrical. If I ask her to puff out her cheeks, it's symmetrical. It's not uneven on one side. Also, whenever she does an expression, the face is evenly symmetrical. There's no uneven distribution of her skin. To palpate the temporal arteries, one on each side. The pulses are palpable, equal on both sides, and the rate is equal on both sides. Okay, I'm going to palpate the TMJ. First, I'm just going to palpate any tenderness there. I'm going to have the patient open and close her mouth. Close it. There's no clicks. There's no abnormal noises. Is there any pain when you open and close your mouth? Do you have any history of lockjaw or anything like that?
No.
So now we're going to assess cranial nerve 5, which is as the patient clenches her teeth. We're just going to see the strength of it. So the patient has good strength when she clenches her teeth. Then we're going to also do the trigeminal cranial nerve, which is cranial nerve 5, which is going to test to see if she's able to detect soft and hard objects against her face. So we're going to do it on various sides of her face. So I want you to close your eyes. And I want you to tell me if this object is hard or soft.
Hard. Soft. Hard. Soft. Hard.
Good. Okay, now we're going to do cranial nerve 7, which is looking at as the patient smiles, as the patient frowns, as she puffs her cheeks, opens her eyes really big, closes them squinted closed, and we're just seeing if it's equal as she does that. And there's no difficulty. The patient's able to do that, and both sides of her face are symmetrical. We're going to do the Snellen chart, so we're going to walk over here. And as the patient stands 20 feet away, we're going to have the patient read the Snellen chart. We're going to have her close one eye, and she's going to read as far down as she can. 20/20 vision is that she can read the 20 line, and that means that a person with perfect vision can read 20 feet, what she can read at 20 feet. Then we would have her switch eyes and do the same thing. If she was 20/40, that means at 20 feet, she can read what a person with perfect vision can read at 40 feet. So we would assess her left eye, her right eye, and both eyes. Also during this, I would ask to see if the patient wears contacts or glasses, if she has any difficulty seeing.
Yep.
And do you get followed regularly by an optometrist?
Yes.
Good. Now we're going to do extraocular eye movement, which means that the patient is going to look at me and I'm going to point with my finger. She's going to follow the direction but keep her face straight and not move her neck, but just move her eyes. So follow my eyes with my finger. Good. She's able to follow and she's showing no signs of difficulty. Now we're going to accommodate with cranial nerve 3. Good, and the patient's able to accommodate her eyes. Now we are going to test cranial nerve 3, 4, and 6, which means the pupil size, the regularity if they're round. So this would be like your perla. So I'm going to take a look. I'm going to see if that pupils restrict to light. Good. Her pupils prior to being shown light were about 2 to 3 mm, and also they're round. Now we're going to take a look, and we're going to take a look at our exterior structure. So we're looking at her eyelashes, her eyebrows, the hair is evenly distributed across it. Also, we're looking at her eyelids and underneath that skin. You can see that there's no redness. Is there any tenderness to the area?
No.
Okay. Also, we're going to take a look at the eye structures, her sclera, irises, her conjunctiva. Have you had any trouble with discharge or drainage from your eyes?
No.
Also, we can pull down and just look at her conjunctiva. It's white, showing no signs of redness. Now we're going to inspect and palpate the external ears, so we're just going to look at both on each side. Okay, there's no abnormalities found. We're also going to palpate. Any tenderness?
Mm-mm.
Good. Now we're going to test the patency of each nostril, so I just want you to sniff up and down, in and out. Okay, then I want you to occlude one nostril and just sniff in and out, and then do the other side. Good. Have you ever broken your nose? All right, we'll do this again. I'm going to inspect and palpate the external nose. So I'm just looking at it. The bridge of the nose is straight, and I'm just going to palpate. Any tenderness there? Good. Also, now I'm going to palpate the sinuses on the face, the frontal and the maxillary, and just let me know if there's any tenderness as I palpate. Have you ever do you have any drainage from your nose right now?
Mm-mm.
Okay, now using the pen light, I'm going to take a look and I'm going to inspect the patient's mouth. I'm looking at the gums, the teeth, the mucosa, the pharynx, the tonsils in the back. So just say ah for me. The uvula is rising. I don't see any bleeding. Pinkness to the mucosa. The tongue is of normal color. Raise your tongue up for me. Good. The bottom of the mouth. Have you had any trouble with taste buds? Good.
Yeah, me too. I'm scared.
To test cranial nerve 9 and 10, we're going to have the patient, I'm going to use my pen light to look to see if her uvula rises upon saying ah. Okay, so that was a positive response. Then we're going to also have the patient do the gag reflex, which I'm going to put a tongue blade on the back of her throat, and she's should have a gag reflex. Which was a positive response. Also, I'm going to grade the tonsils. Say ah for me. Tonsils are grade 2. Good. Cranial nerve 7, we're going to take a look at the patient's ability to move her tongue in different directions. As she's been speaking and answering questions, I can assess this. Also, I can have her stick out her tongue and just her be able to move it around. Shows that this is a positive cranial nerve response. Okay, now we're going to palpate the patient's lymph nodes, which is going to be the preauricle, which is in front of the ears. The postauricle is behind the ears. And then the occipital is behind the posterior auricles. Then the submental is underneath the chin. Submandibular is underneath the jaw. The tonsillar would be the back of the jaw, close to where the tonsils would be. Superficial cervical would be the back of the neck. Posterior cervical would be farther back in the neck. Deep cervical would be the mid-neck all the way in the back. And then the supraclavicular would be right above the clavicle. Any tenderness in any of those areas.
Mm-hmm.
We're going to test the range of motion of the patient's neck. So we're going to have her put her chin to her chest. We're going to have the patient hyperextend her neck going all the way back. We're going to have the patient just turn from side to side. We're going to have her do that against resistance. So push against me. Good. Also, put your ear to your shoulder. The other side. Any trouble with that? We're going to have the patient shrug her shoulder, which would be the accessory cranial nerve. So shrug your shoulders. Also, we can do that against resistance. Good. I'm now going to palpate the trachea and the thyroid. So I'm going to just feel for the trachea. It's midline. There's no deviation. Also, I can check for the thyroid standing behind the patient. Now she swallows. We're able to feel the thyroid. Any tenderness there?
Mm-hmm.
Good. Now we're going to inspect for the carotid pulse. We're just going to take a look. I see no pulsations on either side. I'm going to now palpate each side of it. Pulses are equal, bounding on both sides. Also, I can listen to the carotid arteries to hear for any bruits, which would be just abnormal airflow going through, or blood flow. Okay, now I'm going to inspect and palpate the posterior chest. So I'm just inspecting as the patient's breathing. I'm just seeing that her chest is rising equally. She doesn't show any signs of shortness of breath, no difficulty breathing. Do you have any respiratory history?
No.
Okay. Now I'm going to palpate. I'm looking for things like fremitus, or I'm looking for things like crepitus, which would be crackles underneath the skin. Good. Now I'm going to palpate for fremitus. So as I do this, I'm going to have the patient say 99, and I'm going to hear a vibration. Say 99.
99. 99. 99. 99.
Good. Now I'm going to percuss over the 9 lung fields, and I'm just going to be listening for resonant sound, which would be hollow due to the lungs being filled with air. And the lung bases, if they were filled with fluid, they would have a different sound to them. Now I'm going to percuss CVA for CVA pain or flank pain. I'm going to either palpate or I could percuss and see if the patient has any tenderness with that. Any pain with that? Now I'm going to auscultate for breath sounds across all 9 lung fields on the anterior and posterior chest. Just take a big deep breath every time I move. Now to the anterior side of the chest. Okay, now I'm going to inspect and palpate the arms. So I'm just looking at the patient's arms. There's no sign of swelling. They're both the same size. They're even in color. Now I'm going to palpate the arms just to see if there's any pain. Have you ever had any injuries to your arms? Now I'm going to palpate the different pulses that are on the arm. So I'm going to do the brachial pulse first. And I'm going to compare it to the other side. I'm going to do the radial pulse. The ulnar pulse. And all pulses were equal, they were bounding, and there was a regular rate on both sides. Now I'm going to do capillary refill by looking at the patient's fingertips and seeing if the blood flow returns, which is returning within 1 to 2 seconds, which is a normal finding. So we are going to now do range of motion of the shoulders. So we're going to have the patient flex her shoulders, and then extend her shoulders. Also raise them up above your head. Okay, now we're going to abduct your arms away from your body, and then adduct them. Good. Okay, now we're going to do range of motion of the elbows. So we're going to have the patient flex her elbows and extend her elbows. Also supination of her elbows and pronation. Also, I can test strength by having the patient, I'm going to push against resistance and push against me. Good. And the other one? Good. And both of them were equal on both sides. Then also I'm going to do range of motion of the fingers and the wrist. So I'm going to have the patient flex her wrist and hyperextend her wrist. Then I can have the patient spread out her fingers, make her fist into a ball, and then do it like this to each of your fingers. And there's no difficulties there seen by the patient. I am going to test the cerebellar function of the patient by having to do the finger to nose test. So I'm going to put my finger here, and the patient's going to meet my one finger there and go back and forth from my finger to her nose. You can have her do it rapidly if she's able to do it. Good. Now do it with the other hand. Patient's able to do that quickly. She's hitting the nose and the finger, and there's no signs of difficulty during that test. Then we are going to do graphesthesia and sterganosis, which is the patient's going to close her eyes and she's going to put her palms up, and I'm going to write something in her hands, and she's going to be able to say what that letter is.
A.
Good.
X.
Good. I'm now going to do a number. You can test for that.
3. 1.
Good. And the patient was able to do that. Then we're now going to do sterganosis, which is the patient is able to identify an object while her eyes are closed. So go ahead and close your eyes for me. Put your hand out and see if you can identify that object.
A pen.
Good. Put your hands out again.
Bottle of water.
Good. This is really good test for people that have Alzheimer's disease. Now we're going to rate the reflexes of the upper extremity. So I'm going to do the bicep, the tricep, and the brachial reflex. Now the patient just kind of relax her arm. I should see this muscle flex. Do this from this way. This tricep should flex. Should be able to see that muscle. I can do it from here. Relax your arm. And the brachial reflex would be, the hand should twitch. The fingers should. There we go. Good. So the patient had 2+ reflex, which means that it was within normal limits. Now we're going to have the patient lie down. We're going to inspect and palpate the anterior chest. So I'm just taking a look at the chest. I'm just looking to see, again, normal chest rise. It's symmetrical on both sides. I can palpate the anterior chest just at those different spots. I'm looking for crepitus. Nothing seen. The patient, as I'm looking at her rate of breathing, it's within normal limits. Inspiration on expiration within a big deep breath, and then let it out, and the chest rose equally bilaterally. I'm also going to take a look at the patient's pericardium, which is all pigs eat too much, aortic, pulmonic, herbs, tricuspid, and mitral, which is at the second. Aortic would be on the second rib on the right side. Pulmonic would be the second rib on the left side. Herbs would be the third rib. Tricuspid would be the fourth rib. And then left mid-clavicular on the fifth rib would be your mitral. So I'm just taking a look at that. Then I can also palpate it for any pulsations or thrills. And go down each spot. And nothing, no abnormal findings there. Then I can also auscultate both with my diaphragm and my bell to listen to see if there's any abnormal findings. We can do it now with the bell to listen for any low-pitched noises. I can also listen to the apical pulse for 1 full minute to get the heart rate. Now we're going to take a look and inspect the skin of the abdomen. So the skin is normal color. I don't see any changes in coloration. We also can take a look at the contour of the stomach. There's no pulsations. I can't see any peristalsis visible. Umbilicus. We can also take a look at the umbilicus. There's no signs of any hernias. Have you ever had a history of any hernias? We also can listen to and auscultate bowel sounds in all 4 quadrants. It's lunchtime. Then we can also auscultate over the aortic and birenal arteries to see if there's anything like any bruits. We can then percuss over the abdomen. We can see if there's any tenderness. Also, we can listen for noises over the abdomen to see if it's hollow or if it's dense. Then we can palpate the abdomen using light and deep palpation. Light palpation would be 1 to 2 centimeters, and the patient would just let you know if there's any tenderness. Deep palpation would be 3 to 4 centimeters. Also, you can palpate for the liver with deep palpation to see if the patient, she's of a smaller stature, so you're able to palpate it with deep palpation. Okay, now we're going to inspect the lower extremities and palpate to see if the patient has any tenderness. So upon inspection, I don't see any edema. They're both of the same size, the same length. I can also palpate to see if the patient has any tenderness, any injuries to your lower extremity. Good. Also, then I can check for the pulses bilaterally, so I'm going to do the popliteal pulse. I can do the posterior tibialis. And I can do the dorsalis pedis. And all the pulses are equal rate and rhythm, and they're bounding equally. There's no edema seen over the lower extremities, none seen over the pretibial area. Also, we're now going to do range of motion of the lower extremities. So we're going to have the patient go ahead and flex her hip just by raising this up. Put your knee to your chest as far as you can go. Good. And do the same thing with this leg. Good. Then we can have the patient flex her knees. Just put them up. Good. Go ahead and put them down. Okay, good. And then also we can have the patient plantar flex or dorsiflex her feet, and then plantar flex would be going down. I can also do it against resistance for strength. Good, and then I can do it the other way. Good. I can have the patient internally rotate her hips, and then externally rotate her hips. Then I can have the patient invert her ankles, and then evert her ankles outwards. Good. We have the patient, we're going to test her reflexes of her lower extremity. So I'm going to have the patient sit on the side of the bed. For the patellar reflex, I'm going to sit back. There we go. Good. And I'm going to just have the patient relax. I'm going to see the leg kind of plump outward. Good. And then I can have the patient lay on her stomach or her back, either way. Probably on your stomach is the easiest. Okay, and I can have the patient I want her feet kind of hanging off a little bit. Go that way. Okay, there we go. So I'm going to now test her Achilles tendon reflex. So I'm going to kind of push against, have a little resistance here, and basically the patient should kind of push against me with that kind of motion as a positive reflex. So Just kind of hit the Achilles tendon. Also, I can do it to either of the sides. Then I can do the Babinski reflex. Would be, this is commonly done in the children, the newborns. In a newborn, the toes extend out, and then in an adult, they flex. So this would be a good test for any age. So the patient's toes kind of flex outward, especially if they're ticklish. So the patient has a positive Babinski reflex. Also on the patellar and the Achilles tendon, there were 2+ findings within normal limits, positive responses. Now we're going to have the patient lay on her back. Okay, we're going to check for low extremity cerebellar function. We're going to have the patient with this leg. You're going to run your heel down your shin. We're looking, the patient can do that with a fluid motion. It's not wobbly. She's able to do it with no trouble, no difficulty. So then do this leg with this heel, run it down this shin right here. And also the patient was able to do it equally on both sides with no difficulty. The patient stand up. We're going to test for balance with the Romberg test. So we're going to have a patient with their eyes open. They're just going to stand kind of feet hip width apart. Then we can have the patient close their eyes. She's still able to remain balanced. There's no wobbliness. There's no unsteadiness. Okay, now open your eyes. Now we're going to have the patient stand with one foot in front of the other. With your eyes open, still able to maintain balance. Now close your eyes. Patient still able to maintain balance, no trouble, no wobbliness. Then we can open your eyes, do it with the other foot in front of the other. Eyes open, eyes closed, no difference. Balance was maintained. Now we can have the patient, we're going to have them walk on their heels. No trouble there. Patient's able to remain balanced, do it. Then we're going to have them walk on their toes. Good. We can also have the patient hop on both feet. Hop on one foot. Hop on the other foot. This can be tapered appropriate to the age of the patient. Now we're going to inspect and palpate the spine. So due to privacy, we're going to have the patient's shirt remain on so I can inspect the spine, see if there's any curvatures of the spine. I can also palpate down the spine. The spinal cord is straight. Have you ever had scoliosis before? I can also check for range of motion of the spine so I can have the patient touch her toes. Good. Now stand up. Now you're going to kind of hyperextend your back a little bit. Good. And then now I want you to kind of twist your shoulders from one side to the other. Good. To now conclude this physical assessment, we're going to do the whisper test on the patient. So she's going to be sitting there. I'm going to explain to her that I'm going to say 1 to 2 syllable words. I can either have the patient repeat the words or I can just have them raise what hand they hear the word on. So I'm going to say 1 to 2 syllables and you're going to raise your hand on what side you hear that word. Cat. Dog. Sweater. Sock. And that concludes the physical assessment.